My dear brothers and sisters, thank you, Mankul and Smriti, for making me a part of this very special occasion, which is a small but definitely a very concrete and finite step, and a place which will set the pace or create a space and atmosphere for the practice of medicine as it can be and should be. And in that sense, it is going to be the face of futuristic medicine. We collected a team that we introduced, which has all the right people, and with Mankul's leadership, I know him so well, and particularly in the last few years. He has gone way beyond what we learn in medical school, and has delved deep into several spiritual philosophies, schools of yoga, and more important, he has tried to put what he has learned into practice. So he has been trying to very sincerely to practice what he knows. Thank you, Mankul, for putting me in the distinguished company of Sister Shivani and Dr. Raj Kubba, and asking me to speak on integration. Integration is something that can be looked upon from different angles and at different levels. But one thing is certain, any integration is better than disintegration, just as we say that any love is better than no love at all. But then I'll not go into the various angles from which integration may be looked at. For example, I'll talk nothing about national integration. What I'll start with is integration of different parts of the being. And even if we start with the parts of the being that we can easily identify with, that is the body and the mind, or to put it in Sri Aurobindo's terminology, the physical, vital, and the mental. The physical, of course, we understand is the body. The vital is the emotional part of the being, and the mental is the intellect. So these are the two aspects of the mind, the emotional part of the being and the intellect. Even if we look at just these three, we find that there is no integration by and large. By and large, there is no integration even between these three. As Sri Aurobindo says that these three are at war with one another. And if there is someone who is trying to sort of bring about some sort of an integration, it is our ego, which is a very bad leader. And although these different parts of the being try to pamper the ego and cater to it, but then the emotional part of the being particularly is a bully, and even the ego can't control it. In some parts of India, I have seen that the traffic policeman, he just does this. This much is not enough. He does this, and still that some of the cars being driven by some bullies don't stop. And then he says this, okay, I can give up. So that is what happens in the body. Also, the emotional part of the being is a bully and gets away with what it wants. So with these three parts of the being, as Sri Aurobindo says, being at war with one another, how can we think of integration? If anything can integrate them, it is something that they all at once realize is something far wiser, and therefore they feel that their welfare lies in listening to it, in conforming to it, in being in tune with it. And therefore it is the discovery of that part of the being which deserves and not demands, but earns this type of an allegiance is what is important. And that part of the being, unfortunately, is not very easily visible. Even if we have some sort of vague idea that we have a divine essence, the soul, what happens is that most of the time we ignore it, and our life is not organized around it. Sometimes it's relegated to the position that yes, there is a soul, it is immortal, and therefore we have the consolation that even after we are dead and gone, at least some bit of us will continue to live, and it stops there. We don't think that it has any part to play in our day-to-day life. But in fact, it is not something as inert as it looks. It is capable of guiding us, and it puts in that small little whisper at the opportune moment, which can tell us what the right thing to do is in a particular situation. It provides situation specific and individual specific guidance, which no ethical code does. And that is where the importance of this dynamic aspect of the soul, which Sri Aurobindo and the mother call the psychic being, comes in. And which means that we have this super guide which knows everything and is capable of doing everything within us. And therefore, if we align ourselves to it, let it illumine the surface, that is the body and the mind, we find that not only the body and the mind can be guided and can be at peace, can be in harmony, we also find that they can do wonders. Their capacity, their ability to do something goes up enormously. And this is something which should be particularly important when we are talking about health, because our body has enormous self-healing capacity. In fact, it is geared more for health than for disease. But if there is a disease, it has tremendous capacity for self-healing. And that it can do if we give it a chance. And that chance it has if it is aligned with that highest power within us. And therefore, integration of different parts of the being, particularly that part of the being which in fact is our true sense, our true self, that is our soul, it is aligning with that which can not only give us a harmonious life, a peaceful life, a happy life which is independent of all external circumstances, but it can also give us good health, we understand. So, in fact, health is not divorced from the integration of different parts of the being. Now, just switch gears and talk a little bit about integration of different systems of medicine, which is also important. And the type of integration that is achieved at most places, and to start with, probably that is all we can do, is something which will happen here also, that is put together at one place, side by side, somebody who's practicing allopathy, another practicing Ayurveda, yet another practicing homeopathy, and another one trying to depend primarily on the mind-body approach, being a psychologist, and so on and so forth. Now, that is better than no integration at all, but in fact, that is not what should be the ultimate goal. The ultimate goal I would look at would be the type of synthesis that Sri Aurobindo has worked out of different schools of yoga in the synthesis of yoga. And he says that synthesis is not putting different types of yoga side by side. For example, if some school says that, well, if you come and do a program with us, you will be doing asanas, so that is Hatha Yoga. You will be also doing some meditation, that is Raja Yoga, and you will also be listening to bhajans, that is Bhakti Yoga, and we'll give you some lectures, that will be Jnana Yoga. So that is integration. But that is not what integration is about. Firstly, integration should be such that we should be able to bring it into our daily lives. That's one thing. The second important thing in integration is that true integration can be achieved by looking at the central principle of all schools of yoga and then adding to it, to the extent it is appropriate, the peculiar or unique features of different schools of yoga. The same thing can be done for medicine. Now, what is the central principle of all systems of medicine? The central principle of all systems of medicine is that prevention is much better and easier than cure. We are geared primarily for health, and that in addition to whatever we do to assist the self-healing mechanisms of the body or to supplement them, in fact, what is most important is these self-healing mechanisms themselves. So without cooperating with these self-healing mechanisms, without believing in them, no system of medicine can succeed. And that is the central principle. But then add to that the unique features of different systems of medicine. For example, allopathy, some of the features Dr. Rajkumar talked about just now, and we are familiar with how it has gone into depth and detail of the structure and function of the body and devised on the basis of that various tests which can give us very accurate diagnosis and so on. Now that is the unique feature of allopathy, or which is better called modern scientific medicine. But then there's a lot that we can take also from Ayurveda. Uh, Ayurveda looks at the totality of the being the way modern medicine has only just now started doing in a half-hearted manner. Ayurveda looks at the body mind and what is behind the body and the mind, that is the soul. That has been always one of the unique features of Ayurveda. And then to depend as much as possible on a lifestyle as a whole rather than depending upon one modality of treatment has again been featured in Ayurveda, which again modern medicine now has started realizing and started practicing in bits and pieces here and there. And another important thing in Ayurveda is that the treatment has to be individual specific. We can't treat every individual in the same way. So the person who has the disease is just as important as the disease that the person has. And that again modern medicine now starts talking in terms of pharmacogenetics and so on and so forth. So those things are in the same direction. And in fact, there is also, they found that there is a great deal of correlation between the genetic makeup of a person and the prakriti, as they call it in Ayurveda. And there's a great deal of correlation. Now, when we talk of the genome, it looks very scientific. When we talk of the prakriti, the vata, pitta and kapha, we say, well, that doesn't look so scientific. It may not look scientific because it has been spoken in a language which we do not fully understand. But all the same, if you see the prakriti of the person, the dominant doshas in different weather and the dominant effect of different types of food on these doshas, you find that how we stay in health and how we fall ill and why a particular person is more prone to a particular type of disease and why certain diseases flare up in a particular season. All this based on these three elements, the vata, pitta and kapha, the entire theory is internally consistent. And that is what is important. We may not understand the language. And then you may say that, well, why not do it on the basis of modern science and determine everybody's genome? Then we will know the prakriti. Now, that will be not only extremely expensive, but perhaps may not give us information as readily and as valuable. It may tell us about the person, but not about the seasons and the foods. And on the other hand, at least to get a fairly good idea of the prakriti of a person, all you need is to answer a questionnaire which is available. So many versions of that questionnaire are available on the internet. You have to spend nothing. You can do it on your own. So, I mean, why do you have to bother about the genome when you have the whole thing available? Yes, now you have validated it using modern science showing that it has a correlation with the genome. If that satisfies some people, good, but then you don't have to worry about the genome while treating a patient. Determining the prakriti using a questionnaire, I think, should be good enough. So, take the central principle of all systems of medicine and add to that the unique features of different systems of medicine, and that would be a true synthesis if we are able to achieve a single harmonious entity out of it. And who better than to do that than a person like Dr. Mankul Goel, who has very sound background in modern scientific medicine and through self-study has gone into Ayurveda, into various other body-mind approaches and into spirituality, both in theory and practice, and therefore he is very conscious of the totality of the being, and that is what reflects in his personality. I very often tell him that your name should not be Mankul. With the same spelling, we can call you Mancool. जिसका मन हर वक्त ठंडा रहता है. Just look at the way he speaks. I mean, that itself creates so much peace. And if you speak in that peaceful voice to the patient, आधी बीमारी तो उसी से ठीक हो जाती है. And that is what is important, and that he is able to do because he is himself truly aligned to his deepest self, and that is what is important. And does the personality of the doctor, what is going on in the mind of the doctor, the healing intentions of the doctor, do they affect the patient? It's folk knowledge that उस डॉक्टर के पास कोई भी जाता है तो फटाफट ठीक हो जाती है, उसके हाथ में कुछ शफा है. Now what is that shafa? The shafa is exactly this. That is why with the same education and prescribing the same medicine, one doctor succeeds more than the other. And again, in spiritual terms, it's very easy to understand, because anyone who understands that he has or she has a deepest self, which is the divine essence of the soul, from that it's one step further to realize that the same is the divine essence of everybody else and everything animate and inanimate in the creation. So, if that is the same, the boundary defined by our skin, which separates one person from another, is only a partial reality. It is not the highest level of reality. The highest reality of reality is the consciousness of the creator or the spirit of the creator, that is all pervasive. And therefore, there's really no breach of continuity between the doctor and the patient. And therefore, there's no, since the doctor's mind is a manifestation of the same consciousness, of which the patient's body is a manifestation, and then the air gap that is separating the two is also a manifestation of the same, where is the discontinuity? And therefore, one mode of manifestation, that is the patient's mind, can, without any breach of continuity, influence the patient's body, which is a manifestation of the same consciousness. So that would be the spiritual explanation for how the doctor's sincere healing intentions can in themselves help the patient. And therefore, what it also means is that firstly, the healer doesn't necessarily have to be a doctor. Anybody can have a healing influence. And secondly, since this transmission through this field of consciousness does not require any medium, and it does not travel the way even light and sound waves travel, the effect of this transmission is instantaneous, unmediated, and unmitigated, which means that the healer may be sitting in New Delhi and the patient may be sitting in New York, and still it can be effective. Now, these things may look very irrational and unscientific, but modern medicine has started moving in that direction. Unfortunately, in this country, which has provided the basic foundation, the ancient wisdom which forms the basis of this type of approaches in medicine, has come from India, but we in India are far more skeptical about it than people in the West. The mecca of modern medicine, the Harvard Medical School, as long ago as probably 1997 or something, had an international conference on exactly this type of topics. And this is what Larry Dossey, one of the people who has written a lot on the subject, that's what he calls the era 3 medicine or non-local medicine. That is the way the healer's mind can affect the patient's body. And so these are all things, which are futuristic in nature, and the modern medicine, accepting many of these things, is paving the way for some sort of a synthesis. Why modern medicine able to do is better than many of the ancient Indian systems like Ayurveda is for two reasons. Firstly, Ayurveda and other forms of ancient Indian wisdom received stepmotherly treatment for several centuries because of our slavery, and they were pushed into the background, and we came to believe that our knowledge is outmoded, obsolete, and full of superstitions and so on. So we ourselves came to look down upon our knowledge. And secondly, because modern medicine has that open approach, if something new comes which seems useful, it's able to absorb it more readily. Whereas systems tend to be closed, they tend to stick to the word in the ancient texts. So if we are able to open up a little more and regain that sense of national pride in our own ancient wisdom, which is not just because it's a patriotic duty, but because it is certainly something that we deserve, which had been taken away from us by circumstances. If we are able to recover that, I'm sure we'll be able to see a new face of medicine, which will be good for our well-being in the broadest sense of the words, not just physical and mental health, but that will what give us a better world, a world in which we will find there'll be far more peace and harmony. And in that is how I look at places like this, which can become the nucleus for that sort of a development, because doctors wield a little disproportionately high influence among the population. When a patient comes to a doctor, he looks upon this person with a great deal of respect, and there, if the doctor has this type of a belief and personality, that can influence the society much more than and other ordinary persons. So with that, I'll stop. I don't know how much time I should have taken. Probably I've taken much more than I should have, but once, being a teacher, I have a mic in front of me. I can't trust myself. I'm sorry about that. Thank you.